Tēnā koutou katoa. No mai, haere mai. Welcome here to Tamaki Makaurau, Auckland, for this briefing today, and particularly welcome here to the Tamaki Vaccination Centre, which is really appropriate given the outsized contribution that our Māori and other community providers have made to our COVID efforts over the last significant period of time. My name is nzherald. I lead the Public Health Agency, and I'm joined today by Dr. Pete Watson, the Interim National Medical Director at Te Whatu Ora of New Zealand, and Fiona Manuel, Chief Executive at Te Whai Ora, the Māori Health Authority. Haere mai and welcome to both of you, and thank you for your time today. So today I'm going to begin with an assessment of the COVID-19 outbreak before handing over to Pete, who's going to talk a little bit about how the health system is tracking this winter. Ariana will talk to us about how Māori providers are continuing to respond to COVID-19, and we'll have some final remarks before opening up for questions. But first, today's numbers. Today we are reporting 4,489 new community cases of COVID-19 and 496 hospitalisations, which includes 13 people in intensive care and 16 new COVID-related deaths. These deaths are still being assessed, but based on the analysis of previous COVID deaths, we would expect somewhere between half and three-quarters to eventually be attributed to COVID-19. Taking a step back from today's numbers, COVID-19 surveillance is telling us that broadly, community transmission of COVID-19 is continuing to trend downwards, and this is now also being reflected in our hospitalisation numbers. The 7-day rolling average of case rates continues to trend downwards across all regions for the fourth week in a row, a further 20% in the week ended 14 August. Pleasingly, the case rate among over 65s, which is one of the groups most vulnerable to severe disease from COVID-19, has also dropped for the fourth week running, decreasing by 24% in that same week to the 14th of August. Finally, case rates among healthcare workers have declined for the fifth week running, and the level of virus circulating in wastewater across the motu is continuing to decline also. Moving now to hospitalisations. In the week ending 14th of August, we've seen a further decrease in the 7-day rolling average of hospitalisations due to COVID-19, down 11.1% on the week before. Hospitalisation rates have dropped in 3 of the 4 regions in the country, rising only slightly in the central region, which represents a plateau for them. This is the second week with a drop in hospitalisation rates after 5 straight weeks of increases. As we've said before, hospitalisations do tend to lag behind trends in case numbers by a week or two, and that is consistent with what we're seeing this time. It remains an incredibly busy time for our hospitals, however, and Pete will talk more broadly on this shortly, but it does suggest there's been a sustained reduction in people with COVID-19 requiring hospital-level care, which is fantastic. Trends in deaths also usually lag reported cases, and as you know, it can take time to assess whether a death was caused by someone having COVID-19 at the time or some other reason. We now have 1,782 deaths that we are attributing to COVID, but bearing both these points in mind, it is important that we're not quite ready to assume that deaths from COVID-19 have truly peaked, although we are very hopeful given the trends that we're seeing in cases and hospitalisations. It's important to stress that thanks to our low levels of community transmission early in the pandemic and our high vaccination rates, New Zealand continues to have a lower rate of deaths from COVID-19 since the start of the pandemic compared to many countries. For example, based on a recent analysis in the UK, their COVID death rate was 2,748 deaths per million population, and in the US, 3,077 deaths per million. If we had the same rate as the UK, we would be reporting over 13,000 deaths and over 15,000 deaths if we were looking like the US. This is no consolation, of course, to all the people who have lost loved ones to COVID-19, and our thoughts, as always, are with them at this time, but it does help put into perspective the significant effort and relative success of the New Zealand approach to COVID-19 over the last 2.5 years. Looking ahead, the modelling from COVID Modelling Aotearoa shows that we are continuing to track at the lower end of what was expected in terms of a second wave this winter. We passed the peak in cases earlier than the modelling suggested, and now hospitalisations are also declining, suggesting these two have peaked, sitting somewhere between 800 and 850 occupied beds across the country in late July. With that, I'm going to hand over to Pete. Pete.
Thank you, Dr. Rold, and it's great to have Rihanna here with us as well. Tēnā koutou katoa. So yes, the recent drop in COVID-19 cases is an encouraging trend. By each one of us sticking to public health measures, we are making a difference. That is despite the fact that over this winter, we and our health system have faced a really huge set of challenges. Never before has Aotearoa been tasked with managing such a high prevalence of COVID-19 cases alongside a really big season of influenza, as well as increases in other winter illnesses. Not only has the high demand on our health services, been at record highs, but this has had major impacts on our workforce. So despite the pressure, winter 2022 has made me incredibly proud to be part of this system of health workers striving every day to make a difference to our patients, whānau and communities. I've seen us supporting our partners in aged residential care. I've seen GPs and practice nurses being incredibly busy out on the front line in their communities, providing a huge range of services to support patients in their homes, and also ambulance services doing their typically terrific job. I've also seen hospitals. That includes all of our clinical and non-clinical teams taking all actions available to ensure patients get the care they need in a timely manner, ensuring as little disruption to planned care services as we can manage. I can honestly say this has been a truly epic task. As a country, we are very, very grateful and fortunate to have such a committed, high-quality workforce. And so to hospital capacity. The health sector has planned for a challenging winter. We've got it, and as a result of the planning, my colleagues around the motu have been able to work together consistently to keep delivering. At the same time, districts have been experiencing their own winter demands, the need for staff to isolate or care for isolating whānau or other care in their families. But with cases of COVID, influenza and other winter respiratory illnesses now signalling encouraging signs of a downward trend, we are hoping some of the pressure on our health system will start to ease. In the meantime, I can report that our work across Te Whatuora regions continues to work to keep New Zealand as well. In the northern region, non-deferrable care, such as cancer treatments, birthing, labour, is continuing to be delivered as clinical urgency is prioritised, as well as this less urgent planned care is now increasing as capacity allows. Services across Te Manawataki region have continued to manage high demand while experiencing higher than normal staff illness. Resourcing has been assessed daily, and this informs scheduling for planned care. In the central region, acute or emergency care, as well as non-deferrable care such as cardiac, thoracic, cancer and paediatric care is largely continuing as normal. This is a fantastic testament to the treatment and being able to be delivered by these services. Across to Waipounamu, and planned care cases are continuing where resources are available. Day cases are also continuing as capacity allows, and districts are continuing to work together to utilise available resources. So for instance, South Canterbury is supporting the Southern District joint replacements, and Canterbury as well in their ENT and gastroenterology lists. So while we do expect a continued long tail of COVID-19 cases and workforce illness, the recent decline of cases is now flowing through to a reduction in severely ill people with COVID-19 who might have been requiring hospital-level care, and this eases pressure on our system. What about RSV? So respiratory syncytial virus in the northern region has been a particularly common cause of hospitalisation for lower respiratory tract infection for under 2-year-olds. Last year, at this time in the northern region, we had 3,800 cases. At this time, we only had 248 positive cases. In fact, during the peak of last year's RSV outbreak, the end of July, start of August, the northern region was dealing with more than 600 cases of RSV a week. Weekly cases this year have so far remained under 100, averaging around 60 cases a week. Of those positive cases that have required hospitalisation, the average stay in hospital has been 2 days. We are also not seeing the same week-on-week increase in cases as we saw in last year's peak. So again, these are encouraging signs. We're continuing to monitor these RSV numbers alongside other conditions and encouraging people to keep up with their current health measures. I'd like to turn to vaccination. Vaccination, of course, remains the cornerstone in our response to COVID-19, but also to influenza and many other conditions, particularly childhood conditions, and it's a very important and critical prevention of measles. We've said it before, vaccination saves lives, but it also reduces the severity of illness and the likelihood of hospitalisation. This winter, the government has widened access to free flu vaccines for people, including children, who are at more risk of hospitalisation, and made second COVID-19 booster available 6 months after the first booster for older New Zealanders and other groups. That's made it easier than ever to get vaccination. So I'd ask everybody, if you're due a flu or COVID-19 vaccination or a measles vaccination, please don't delay, go and get it today. In closing, I want to reiterate the simple things which count. Vaccination, mask wearing, isolating when unwell, testing, and self-reporting results. It's these basic health measures which have served us well to date. If we do these basic things well, we'll help protect not only ourselves, but our most vulnerable people, our tamariki, our older people, Māori and Pacific communities, disabled people, pregnant people, and people who are immunocompromised. We all know and care about someone in these groups, and our actions to date have helped protect them. Let's keep caring about them. Kia kaha, kia ora, koutou katoa. Thank you, and I'll now hand over to Rihanna. Kia ora, Rihanna.
Tēnā rā koutou katoa, e hui mai nei I raro I te maru o tēnei whare a tāhua, nei ngā mihi ki Ngāti Whātua, ki Warakai, engari mō tō koutou tautoko, tiaki, manaki I a tātou katoa I tēnei rangi. Good afternoon, I think we're in now. I've just got a few things to add and just really want to acknowledge first and foremost the hard work that's been done on the front line all throughout the motu by not only our kaupapa Māori providers or our iwi providers, but by all of our providers, as mentioned by my colleagues. I also want to reiterate and acknowledge the importance of vaccination and what the role that it plays here for our people. It remains the best protection against preventable diseases in general. I now want to talk to and remind ourselves that COVID is not a seasonal disease or virus. And while COVID numbers may be decreasing, our Māori providers are still too aware of the work that lies in front of them. And whilst those providers are out there working every day, I want to acknowledge that they are a defence force who provide unwavering commitment to our Māori communities when called upon. And not just the Māori communities, but all communities around the motu. Across the country, they are working at pace to keep providing the services that are not just services around hauora, but also acknowledging the kai hub, the health in the community, care in the community, and those who are isolating. Our outreach programs such as Te Whātoro Hauora Outreach, which is a collective and collaborative of Te Tautokero providers. They mobilise through 6 campervan units. They get out to hard-to-reach areas of the north. They set up this in June this year and, of course, include the 6 providers such as Ngāti Hine, Te Whare Āwhina o Ngāti Tautai, Te Hau Āwhiowhio o Tāngarai Trust, Te Iwi o Ngāti Kahu, Te Manga Pūriri and Te Raro Trust purchased the campervans and have provided the services. It was an opportunity to be mobile, to reach more remote communities, because whilst we have our clinics and our hubs in our more urban centres, we have to remind ourselves of the need of our rural communities. And also want to acknowledge urban initiatives such as Tāmaki Health Hub. This is a Ngāti Whātua Ōrākei initiative who not only vaccinate here every day, and we've just seen it for ourselves as we walked in, but they also offer a social supermarket, full health checks, vaccinations, and of course childhood immunisations. I just want to point out that initiatives that have popped up during COVID, such as the social supermarket, have been one of the most amazing disruptive innovations. And I just also want to acknowledge that prior to COVID, kaupapa Māori providers would often reach out and provide these services. So to have them recognised and ongoing funding available means that communities and our whānau, wherever they may be, are able to access basics such as kai, housing support, and of course, this all goes to improving wellbeing for our people. So on that note, one final shout out to all of those providers. Kia kaha, kia maia, kia manawa nui. Kei konei mātou e tiaki, e aki i au koutou i tēnei wā. Just to say that we acknowledge that you're all out there on the front line. We're going to be doing everything we can during this process of te whatuora, te aka whai ora, and te manatū hauora, providing better care and services for our people. Mauri ore te whare.
Kia ora, Rihanna and Pete, thank you. So in summary, there is some good news on the COVID-19 front. We have decreasing cases, decreasing hospitalisations, and we're hopeful that we've turned the corner in terms of deaths as well. I do want to emphasise, however, that COVID-19 is continuing to have a significant impact, particularly among our most vulnerable. While cases and hospitalisations have declined, we are continuing to see deaths on a daily basis, and we can't take our eyes away from that. I would emphasise also that despite the recent decline in cases, and that is clearly good news, this pandemic still has some way to run. There remains the potential for a resurgence in COVID-19 cases, and as Rihanna's just said, we have seen overseas significant waves of COVID through the Northern Hemisphere summer. So it's not going to behave as a seasonal disease. That means it's important that we all continue to take steps to protect ourselves, our whānau, and our communities. Please get vaccinated and boosted if you're eligible. Continue to wear masks in indoor areas outside your home. Get tested and stay home when you're unwell. All these things, as Pete has said, help reduce the opportunity for COVID-19 to spread. Final thing I'll say before opening up for questions is really just to reiterate the call that's already been made to think about other things other than COVID-19 as well. Particularly focus on childhood immunisations. We know that we are at risk of outbreaks of other diseases. Pete's mentioned measles as one, and so just really want people to use this week to check that they themselves are up to date with their vaccinations, and if you have children, that your children are up to date with their vaccinations. It really could make the difference in the weeks and months ahead. And with that, we will open up for questions, and all three of us are able to take questions.
As you said there, Andrew, you're saying cases dropping out for a number of weeks. So it's really safe to say that we're well over that second wave now?
I think that's a fair assessment. We're always a little bit cautious about calling those things too early, but certainly in terms of that second wave, yes, we seem to have passed that peak and be coming down into the next our next plateau. The question that we have now is how low will we go in terms of daily cases? We didn't drop quite as low as we expected between our earlier peak and the second peak, and that's going to be particularly important in terms of the ongoing impact of COVID-19 over the next few months.
As you said, we can't become complacent. COVID is now here with us, and it has been for some time now. Has there any modelling been done about when we might see that upsurge of cases again? I know that we just starting to get down of that second wave, but any modelling going forward?
So there is certainly modelling underway to look at that. We don't have that available here yet, but I think the modelling that's been done recently in Australia out of Victoria is probably instructive for what we might expect. We now have reasonable information from around the world about how COVID behaves. Lots of caveats around the fact that we're always modelling based on what we know, and new variants are always of concern, how they might behave. But we would expect now that we will see continued waves of COVID-19 for some time to come. The questions, which of course the modellers desperately try and answer and are really important for health services like the ones that Pete represents, is when and how high. So those are questions that we're trying to answer.
What you're focusing for about what's happening with plans here around country is quite general. They're saying that it's, for example, in like Onaru, it's happening as and when it can. Can you give us any more detail about the kind of plan here that's still being delayed and how often it's happening?
I don't have the specifics district by district, but everywhere is managing to do more than we were when we were in the surge. So that's the good news. And as the capacity comes available, we're doing more. So everyone is got that very much in the Whatuora districts as something that we need to get on with. I know that the work of the Plan Care Task Force will also be released in the not too distant future, which is going to provide some further guidance and advice about how we go about tackling this, because it's become a big issue that we all recognise. But everywhere is doing the clinically urgent and indicated work, and to a varying degree other less urgent work. But it's done list by list, service by service, district by district. But as I referenced, then we've seen now within Te Whatuora and the new system a much greater degree, I believe, of collaboration and cooperation. So the example of South Canterbury being able to pick up their neighbours' works in some areas is just one example of that, but that's happening across the different districts.
So are there any cases on any days where some of that urgent delays to the heart?
Not that I'm aware of. As I understand it now, all of the cancer and P1 work has been done. In some areas, some of the P2 work, which is the work which is not quite as urgent, needs to be deferred, but less and less of that has been deferred. And in some places now, we're even moving into the P3, that work that can wait the longest.
What are your colleagues around the country telling you, not just about Plan Care, but about the pressure on the hospitals? What are they telling you about how busy things are?
So the health system has been under pressure and continues to be under pressure. So while the COVID cases are decreasing, we've experienced the big surge in influenza. We're over that as well, but there's everything else that's still presenting. And this is across primary care, aged residential care, as well as our emergency departments and hospitals. So it is pressured. And part of that is contributed to by, as I referenced, the pressure on workforce. That the workforce, is so susceptible to the same winter illnesses as in COVID as the rest of us. So there's been high levels of staff sickness and absence because of COVID. So that's been part of the real pressure on the system. So it remains really a big focus to supporting workforce to be able to deliver the service.
Today marks a year since Delta arrived in the country and we went into lockdown. I was perhaps just after a reflection from you on the past year. Yesterday was the last day that we had 0 cases of COVID in New Zealand day. Just after a reflection of the past year and how things changed again.
Sure, and I might ask the others to comment as well, but it's been, a year that I think I highlighted present enormous challenges for us, I think, as a country, as communities, and the health system in particular has been, really tasked with something that we'd never seen before in terms of the volume and how we were going to face that. I'm incredibly proud of the response. It's been really hard. We've got through it, and I think we've done actually a pretty stunning job when you look around and you see how we have managed compared to some other countries by comparison. We've saved a lot of lives, and that's, I think, as a direct result of what we have done to address that, to prepare and be able to manage. But perhaps I'll hand over to others to comment.
I would say that almost a year to the day, we found the first cases down in Coromandel, for instance, and I was on the front line during that time. So when I stand here and reflect on the year that was, it's been an incredible year where I've seen people collaborate, operate. We've had teams out on the road for 7 days of a week during those peak times. We've had people running kaita communities. We've had a country that collaborated like I've never seen before. And, and of course, on July the 1st, we launch a kaupapa that's really dear to my heart. So I think we've through it all, we've maintained this whakaaro, kia whakakotai ai tātou. Let's stay together.
Thanks. Thank you both. And maybe just to build on that a little bit, to say, at the point that we went into lockdown a year ago today, just 23% of New Zealanders had received 2 doses of vaccine. By the time the COVID protection framework was announced 3 months later, that figure was 82%. And so I really want to echo the comments that both Pete and Rihanna have made about the incredible effort that not only the health sector but the community at large put in to keeping us all safe through that time. It's been an amazing year to be part of. It's been incredibly tiring at times, but I think the way that people have pulled together has been incredibly inspiring. The other number that I've got here, which sort of floored me a little bit, is between the 17th of August last year and the 15th of August, so 2 days ago, we've administered 9,039,444 COVID-19 vaccinations to New Zealanders. So, I mean, that just, I think, puts in perspective the size just of that part of the effort.
You mentioned vaccination there. In the UK, you might have seen them approve this dual vaccination of, the Omicron variant and the original variant. Is there any indication or work underway to do that happening here?
So we're obviously watching really closely what's happening overseas with the development of new vaccines for COVID-19. The vaccine that we're using, as people know, was developed really quickly early on, but it was designed against sort of the original strains. We're lucky that it still continues to provide really, really good protection against severe disease and death. But what it's not so effective at now is preventing transmission between people, which is part of the reason why we've had the waves of Omicron that we've had despite our high levels of vaccination. So we're watching those developments really closely. The companies have not made applications here to my knowledge yet, but we're certainly building in some of those things in terms of our future thinking, because I would expect that they will become part of our toolkit in the future.
Since we're coming down to this peak now, would you like to see isolation rules changing?
Look, that's a really timely question. So I think one of the things that we've committed to all the way through is constantly reviewing the set of protective measures that are in place to make sure that they continue to both be protective and be proportionate to the risk that's there. So we're in the middle right now of reviewing the range of measures that we have available to us. As I say, that process is underway now. We'll be providing that advice through to the government for their decision-making process in the next week or so.
And is it looking like those isolation rules might change? Do you have any advice at this stage?
No, I wouldn't want to preempt that process, but just to say that all of the things that are currently in the framework and various protective measures are being looked at to make sure that they're still appropriate and proportionate. And when those, after that advice has been provided, the government will make its decisions.
Monkeypox, if that's all right. I'm not sure who would be the best place to answer that, but are we any closer to rolling out our public health response to monkeypox, and are we any closer to knowing when we might get vaccines?
I can probably start to answer that. I don't know whether Pete wants to add anything, but in terms of our public health response, the public health response is well underway. So there is a group that is working now, which includes community representatives from the Burnett Foundation, with a real focus on the health promotion aspects of prevention. We're really fortunate at the moment that we've just had the 4 confirmed cases of monkeypox in the country, so we have time to prepare. And so the biggest defence at the moment is making sure that people understand what monkeypox is, how it transmits, and what risk behaviours look like in terms of being able to keep themselves and their communities safe. So that work is very much going on. In terms of the vaccine, we are actively working through Pharmac with the vaccine manufacturer. That contact was first made back in May at the time that the first cases were identified. There is a challenge with the global supply at the moment. There is only one manufacturer of the third generation vaccine that we are seeking, and the global demand is high. And essentially, what the manufacturer is prioritising countries where they have significant outbreaks. So that does mean that we're likely to not be right at the front of the queue, but we are hopeful that we'll have more information about a confirmed timeline to share in the next week or so.
To ask about the man who was masquerading as a doctor at Monkeypox. Can you, I'll go through here. Where are the investigations into that situation?
Sure. So as you'll know, that person is no longer employed by Te Whatu Ora County's Manukau, and the matter is now with the police. So as I understand it, an investigation is being undertaken there. I can reassure people that we've undertaken a review of every patient seen by that person, and there have been no concerns found at this point. And we're also taking the opportunity, and I guess this talks to the move into Te Whatu Ora as a national system to ensure that all our employment processes are where we need them to be.
And in terms of, you were also reaching out to talk to patients. Do you know how many you've been able to talk to?
I caught up with that this morning. We're making really good progress on, we haven't managed to contact all of them yet, but all of them we have. There's been no issues identified.
And we heard that they were about 80, is that correct?
Yep, that's correct.
It's time for a couple more questions, folks. I had to suck up for Rihanna. Just another case that's been up this week about a Māori man in Whanui who died after getting a complication of ear infection, and there was suggestion of bias in his treatment. In terms of what the Māori Health Authority can do, they just released a box and saying that, of course, Māori people are still going to be treated in the mainstream health system. Where do you see the Māori Health Authority's role in trying to prevent things like that?
So this is where the importance of partnership between the organisations, all three of our organisations, is imperative to make sure that cases that are so simply preventable, and of course our aroha goes out to the whānau and to that gentleman, because that's not the ideal, it's not the value proposition that we want to be able to offer our people of Aotearoa. But dealing with bias in a system is important, and remembering that during a time of COVID where we've had that much pressure on the front line and people make assessments and of course we make judgments, and we want to be able to support to make sure that all of our kaimahi throughout the system are able to make judgments that don't include any bias, whether it be against people who may have a drug history, or people who are, people who are Māori, or people with disabilities, and so on and so forth. So I think moving forward, our focus has to be on the future. How do we create a better system? How do we make sure that people don't fall through the gaps? How do we ensure that, for instance, otitis media is treated in primary care, that people have better access to make sure that things that are preventable are dealt with sooner?
There's also some Māori nurses calling for a Māori nurse workforce to be prioritised.
Which is absolutely on our program. So we're about to release our chief advisors, which will include a consortium of chief advisor medical, nursing, midwifery, allied health, and most importantly, kaimanaki. And I say that because during the COVID response, you would have seen in here in this building, you will see the kaimanaki workforce who have stood up, they've become vaccinators, they've done that PCR testing when we didn't have the numbers in our clinical spaces to do so. So we want to make sure that there's a space at the table to have a conversation and work out what more could that workforce do in terms of mobilising responses. So yes, absolutely tautoko. And of course I'm a registered nurse, so I want to make sure there are more like me out there. Kei te pai, kia ora.